My name's Steve Anderson. I practice primary care sports medicine. I have a special interest in pediatric and adolescent sports issues. Well, the first thing about any kind of an injury that I try to do is I try to figure out what the cause of the injury is. If you don't identify the cause, then you can't really correct it with treatment. So many overuse injuries will in fact get better if people rest. But what I try to do is figure out the cause and address the cause so they can get back to their activity and not have the same injury recur. So one of the things that's nice about sports medicine is I feel like I'm learning from my patients every day, and I feel that patients are pretty sophisticated, and if you take the time to talk to them about what's going on and what they're doing and what's important to them, you learn a lot about the sports, and you can learn ways of treating them more specifically. I've been the consulting physician for Pacific Northwest Ballet and been working with the ballet company as well as the dance students for almost 25 years and a number of the other dance programs around the area. I take care of a number of teams in sports organizations, and I've done that for quite a while. I have an interest in swimming and diving, and I've been a regular participant in doing medical coverage for high school swimming and diving, for Pac-12, for NC2A. I have been the team doctor for the United States diving team for over 20 years, which has involved attending a couple Olympic Games and World Championships and World Cups. People will sometimes say, "Doctor, you're shooting yourself in the foot if you're trying to prevent these injuries," but that's really part of the mission, is looking at the things that are predictable, whether it's an elbow problem in a throwing athlete or an ankle problem in a ballet dancer or a back problem in a gymnast, and say, well, why do these things keep happening, and what can we do with training and conditioning and education and early diagnosis and more effective treatment to try to reduce some of these predictable burdens that affect athletes.